You're sitting in a doctor's office and they hand you a stack of papers to sign. Sound familiar? That stack of papers isn't just paperwork, it's one of your most important rights as a patient: informed consent. Today, we'll explore what informed consent really means and how it protects you every time you seek medical care. Informed consent is much more than signing a form. It's a fundamental principle that ensures you have the right to understand and agree to any medical treatment before it happens to you. The word informed means you receive clear, complete information about your medical situation and treatment options. Consent means you voluntarily agree to proceed without pressure or coercion. Think of informed consent as a conversation, not a signature. It's your healthcare provider's responsibility to explain things clearly and your right to ask questions until you truly understand. True informed consent includes several essential elements that healthcare providers must discuss with you. First, you have the right to understand your medical condition. What's wrong? How serious is it? What happens if it's not treated? Second, you should know all your treatment options, not just the one your doctor recommends, but all reasonable alternatives, including the option of no treatment at all. Third, you need to understand the potential risks and benefits of each option. What could go right? What could go wrong? How likely are different outcomes? Fourth, you should know about alternative treatments. Are there other ways to address your condition? What are the pros and cons of each approach? Finally, you have the right to ask questions and take time to make your decision. Good healthcare providers encourage questions and never rush you into a decision. Informed consent wasn't always a standard practice. It emerged from hard-learned lessons about medical ethics and patient rights. Today, informed consent serves several crucial purposes. It respects your autonomy, your right to make decisions about your own body. It builds trust between you and your healthcare providers, and it helps ensure you receive care that aligns with your values and preferences. Informed consent also recognizes that you're the expert on your own life. You know your fears, your priorities, your family situation, and your personal values better than anyone else. Medical decisions aren't just clinical, they're deeply personal. What's right for one person might not be right for another, even with the same medical condition. Informed consent ensures your unique circumstances are considered in your care. The informed consent process should unfold naturally over time, not be rushed at the last minute. It typically starts with your healthcare provider explaining your condition and treatment options during a regular appointment. This gives you time to process the information. You might receive written materials, diagrams, or other resources to help you understand your options. Don't hesitate to ask for information in a format that works best for you. Take time to write down questions as they occur to you. No question is too small or silly. It's your health, and you have every right to understand completely. Decision time. You should never feel pressured to decide immediately. For non-emergency situations, it's perfectly acceptable to ask for time to consider your options, do additional research, or consult with family members. Remember, consent isn't a one-time event. As your treatment progresses, new information might emerge or circumstances might change. You always have the right to ask questions and reconsider your decisions. In medical emergencies, the usual informed consent process might be modified. When you're unconscious or in immediate danger, healthcare providers may need to act quickly to save your life. However, even in emergencies, providers will seek consent when possible and explain their actions as soon as you're able to understand. If you're unable to make decisions for yourself, a designated surrogate, often a family member or healthcare proxy, may provide consent on your behalf. This person should make decisions based on what you would have wanted. For minors, parents or guardians typically provide consent. However, as children mature, healthcare providers increasingly involve them in age-appropriate discussions about their care. You have specific rights when it comes to informed consent, and these rights are protected by law and medical ethics standards. You have the right to receive information in language you can understand. If English isn't your first language, you're entitled to an interpreter. If medical terms are confusing, ask for simpler explanations. You always have the right to refuse treatment, even if your healthcare provider disagrees with your decision. Your provider should respect your choice while ensuring you understand the consequences. You can withdraw your consent at any time, even after treatment has begun. However, some procedures can't be reversed once started, so timing matters. You have the right to seek second opinions, especially for major procedures or life-changing diagnoses. Most healthcare providers encourage this for significant medical decisions. While most healthcare providers respect the informed consent process, it's important to recognize situations that should concern you. Be cautious if you feel pressured to make immediate decisions for non-emergency situations or if providers seem impatient with your questions. Incomplete information. Be concerned if providers won't discuss risks, alternative treatments, or seem evasive when you ask questions. You deserve respectful treatment. If providers dismiss your concerns or make you feel foolish for asking questions, consider seeking care elsewhere. Here are practical strategies to make the most of the informed consent process. Write down questions before your appointment. Bring a list of your current medications, allergies, and relevant medical history. Consider bringing a trusted friend or family member to important appointments. They can help you remember information and ask questions you might forget. Don't rely on memory alone. Take notes during your consultation, or ask if you can record the conversation for your reference. Request written materials about your condition and treatment options. This gives you something to review at home when you're not feeling stressed or overwhelmed. Don't hesitate to call with follow-up questions. Most providers prefer that you ask questions rather than proceed with uncertainty. Informed consent applies across all healthcare settings, but the process might vary slightly depending on where you receive care. For routine procedures and treatments, informed consent might be relatively straightforward, focusing on immediate risks and benefits. Surgery typically involves more detailed consent discussions, covering anesthesia risks, surgical complications, recovery expectations, and alternative approaches. Research studies have especially rigorous informed consent requirements, including detailed explanations of study procedures, potential risks, and your rights as a research participant. Informed consent is one of your most fundamental rights as a patient. It ensures that you remain in control of your healthcare decisions and receive care that aligns with your values and preferences. Remember, you're not just a passive recipient of medical care. You're an active participant in your healthcare journey. The informed consent process recognizes your autonomy, intelligence, and right to make decisions about your own body. Don't be afraid to ask questions, seek clarification, or take time to make decisions. Good healthcare providers want you to be fully informed and comfortable with your choices, your health, your body, your choice, but only when you have the information you need to choose wisely. That's the power of informed consent.